Hodgkin's lymphoma. Hodgkin's lymphoma is originated in a single lymph node and is spread along the lymphatic system. Malignant cells is HL or red Steinberg cell. Most common site for lymphadenopathy are cervical, supraclavicular and mediastinal. Vein system symptoms are the characteristics of HL and they include fever without chills, drenching sweat and unintentional weight loss. Diagnose external lymph node biopsy show red Steinberg cells. Management chemotherapy and radiation therapy. Non-Hodgkin's lymphoma. Non-Hodgkin's lymphomas neoplastic growth of the lymphoid tissue which involve malignant B lymphocyte. Lymphadenopathy is one of the clinical manifestations. 1/3 of the client will be having the symptoms. Management chemotherapy, radiation therapy or combination of both. Multiple myeloma. Multiple myeloma malignancy of plasma B cells. These malignant plasma B cells infiltrate bone marrow and cause destruction. The infiltrated B cells produce excessive amount of immunoglobulin, myeloma protein. Accumulation of myeloma protein affect hematopoiesis and lead to anemia. Increase hematopoiesis and lead to anemia. Increase chance for infection and bleeding tendency. Most common presenting complaint in bone pain, cell destruction lead to hypercalcemia and renal stone. Diagnosis, radiography studies, bone marrow examination, blood and urine study. Management, autologous bone marrow and peripheral blood stem cells transplantation and high dose chemotherapy. And discuss next topic and bone marrow transplantation. BMT, bone marrow transplantation. BMT help to replace unhealthy blood forming cells with healthy ones. Hips, breastbone, spine, ribs and skulls are usually the site of choice for bone marrow aspiration. Autologous bone marrow transplant. Bone marrow is taken from one person and transfused back to same person. Allogenic bone marrow transplant. Bone marrow is taken from one person and transfused to another person of same species. Umbilical cord blood transplant. Umbilical cord blood is harvested immediately after delivery and this blood has the capacity to provide stem cells and can be used in future if child need cells and the can use in future in child needs. Human leukocytes antigen HLA needs to be checked before BMT. Okay guys, thank you very much.